Once again, a little unusual. We have a short week because it's Thanksgiving. And so we wanted to give information today on a Monday, which is a little bit unusual. But thanks for those who are participating. We appreciate, again, the media helping us get the information out. We still are in challenging times. I'm sure that's not a surprise to anybody as we see the case counts continue to, we're kind of leveling off a little bit now, but still way too high. We'll have new numbers today, which will show us a little bit of hope as we go forward. But in spite of the challenge we face as Utahns and as Americans and literally around the world, as we have this Thanksgiving week, I hope we have opportunities to reflect upon all the things we should be thankful for, which there are many. It really is wanting to foster an attitude of gratitude for all of us because we have a lot to be thankful for this Thanksgiving time. And we hope that people will have the opportunity to celebrate Thanksgiving. But we want you to not only have a happy Thanksgiving, but a safe Thanksgiving. So we'll remind you all about the protocols, which you've heard many, many times before, but are no less important today than they were, a few months ago. As we have this opportunity to pause from our work and give thanks. Again, remember to have a safe practice as you gather. You increase the risk when you bring people into your home that are from outside of the four walls of your house. That's just a harsh reality of what the data shows us. So bringing people in from outside your walls is going to increase the risk of you having somebody that will share with you the COVID-19 virus. When you gather, if you are gathering together, you should wear a mask. Along with social distancing, the combination of both those things will help, again, minimize risk. And as you gather, the smaller numbers that you gather with, the safer you will be. Again, smaller is better as far as minimizing risk. I had a doctor call me and say, you need to emphasize more, Gary, about washing of your hands. That's a part of the protocol. We talk about hygiene, appropriate hygiene, but we need to wash our hands regularly. With hot water and soap. If you don't have hand sanitizer, that can be used as an augmentation of hand washing. But again, that's how we transmit the disease, the virus, around with our hands. And so wash your hands 20 seconds. We've talked about singing happy birthday to yourself twice, and that gives you the time to wash your hands. We also would encourage you, again, this Thanksgiving season, not to have potluck dinners. Not to have people bring, one from outside your household, but then to bring food. The food should be prepared by one person and dished out by one person too, and that person should be wearing masks when they prepare the food. So again, keep it short. The gathering together not only should be small in number, but it should be in short duration. I know this is contrary to Thanksgiving and football and all we have on television that day, but again, just if we want to minimize the risk, those are the protocols that you should follow. We hope we're going to be seeing the effects of this pause we put in place. And I think there's indications that we, in fact, are starting to flatten out a bit. We have another week to go, really, to kind of test what we've done in modifying our system through our last health order. But we are asking people to stay the course one more week and see what we can do there. We certainly are taking steps to increase testing. We mentioned that a week ago too. We'd like to increase our testing by, 2 or 3 times. We'd like to be able to do 250 to 300,000 tests a week, and we think that will allow us to find people and isolate them to help slow the spread. Find out really who's got it and what we need to do, in fact, to isolate them and slow the spread. We have a particular emphasis on our younger people, our college-age students. And the casual gatherings they tend to be involved with, and so that's going to be a major emphasis. Increased testing for those who are asymptomatic. Again, this is an evolution of learning. We started out not believing that people that were asymptomatic could spread the virus. We now know that they can and do. And so we're trying to get everybody tested, including those who have no symptoms, to find and isolate them. And we all know that I think for the first time in a long while, we see a little daylight at the end of the tunnel. The fact that we have now vaccines which are made available, or going to be made available in the next couple of weeks, that have 95% effectiveness when it comes to vaccinating us against COVID-19. That should give us hope as we see some daylight at the end of the tunnel as we're moving forward. So the next 2 or 3 weeks, I think we'll see our first opportunities here in the state of Utah to inoculate people, and we'll look forward to that opportunity. That will be kind of a crescendo, so as we get into the spring of next year, 2021, around, I think, probably around March, April, we'll see the vaccine being made available to all in the general population. So again, I think there are reasons to be thankful and grateful for where we're at and the direction that we're moving in. So again, my last comment should be thankful, be careful. Follow the medical and science recommendations we have a safe and happy holidays, and if we do that, we'll be around for the holidays for next year too.